歡迎大家出席今日嘅記者會。
Welcome to the press briefing. We have Dr. Chong Shok Kwan, head of the Communicable Disease Branch, and Ms. Ho from the Hospital Authority. Dr. Chong will update you on a number of cases. Last night, 6,663 confirmed cases, 3,806 cases confirmed from testing at the TMHK laboratory. 2,257 cases were confirmed at the Hospital Authority laboratory. Of the 3,806 cases, 60 cases contain the L452R variant strain, and 2,769 cases do not contain the L452R strain. 22 cases yet to be confirmed because the load is too low. Now, there are 4 infected cases, 6,058 cases, 59 cases are local cases. And then so far there are 30 homes with either preliminary positive cases or rapid test positive cases involving residents and workers. In conclusion, we keep getting new cases, and there are about over 190 homes with cases involving either the residents or the staff. And there are about 120 plus employees at residential care homes, and 450 residents who tested positive with the PCR test or rapid antigen test. Now we know that there are, close contacts in a household, and they may be under pressure, and then people have been waiting for a long time for arrangement. But please be understanding with the frontline staff, including the auxiliary medical services staff or the audio staff. They have to deliver packs and electronic wristbands to people in home isolation. But please be understanding, because there is a surge of cases so substantially, so in some cases people may have to wait a bit longer. And then we've also done some analysis. From the 31st of December to now, there have been 46 death cases. Only 6 were vaccinated, according to our record. For the other death cases, the patients involved did not get vaccinated. And for the 6 patients who were vaccinated, 3 took 3 doses of coronavac. 1 case took 2 doses of BioNTech, and 2 cases have had 1 dose of coronavac. Now, Dr. Ho, please. Yes, there are 3,312 confirmed and preliminary positive cases in the North Lantau Hospital, Hong Kong Infection Control Center, Hospital Authority Infectious Disease Center, AWE Community Treatment Facility, and public hospitals. There are 2,400 patients in the Penny's Bay Community Isolation Facility, and over 100 patients are at the Tsuen Wan Community Isolation Facility. 15 patients passed away. 264 patients have recovered and been discharged. And the occupancy rate of public hospital beds has reached 90%. That's already the upper limit of what we could cope with. Now, hospital authority staff have been working very hard last night. Now, for patients stranded in outdoor tents, outside accident and emergency ward, they have all been moved indoor. And for the tents, they are now used simply for triaging and testing. Now, it's a tough process to move patients indoor, and I would like to thank colleagues again for their hard work. I'm also grateful to patients for their understanding. Now, for patients stranded in the past few days, our apology again. please do understand that the crisis is not yet over. We are very much worried that if we have several thousand confirmed cases every day over a prolonged period, we'll exhaust all the isolation facilities soon, and then patients will pack the accident and emergency wards again. So we are now in discussion with the government. We would like to boost the capacity of isolation facility as soon as possible. And then in hospitals, we have also converted many indoor facilities. And then we have also curtailed non-emergency services at our clinics and other day centers. So in future, these facilities will be used for holding patients who wait for treatment. And then in the past 2 days, we have been making an appeal to the private sector to join us in the fight against the epidemic. And we're grateful to private practitioners for their positive response. Now, I would like to give the WhatsApp number again, 97888960. So we have enhanced the WhatsApp system again. Now, if private practitioners just upload their practicing certificate and the WhatsApp group, then we'll have staff contacting them on the work arrangement. And this morning we WhatsApp 3 private practitioners this morning, and in the afternoon already they have signed a contract and they have started work at the hotline service. So we appeal to private practitioners to join us in our fight against the epidemic. Over 160 of our employees are preliminary positive cases. They have been infected either in the community or in their own homes. And then there are 30-odd patients screened to be preliminary positive when they were admitted to hospitals. So some 60 patients in the same ward are listed as close contact. And then the Hong Kong Red Cross Center has received notice of blood donor who is now a confirmed case. On the 27th of January, the donor gave blood at the West Kowloon Station. The blood he gave was turned into free blood product. Blood platelets was used on a patient in Tuen Mun for the red blood cells. They were used on another patient at Yan Chai Hospital. The healthcare team will follow up on these cases. And for these 2 patients, so far they tested negative. As for the blood plasma is not being used, the center is already recovered we recovered that blood plasma product.
So far, we have 7,400 preliminary positive cases. The floor is now open to questions. Please put up your hand. Our staff will pass you the microphone. Before putting your questions, please identify your media outlet. The journalist, the gentleman over there. RTHK. Question for Dr. Chuang. About the Shengshui slaughterhouse, the infection cases there, do we see any increase in infections there? And for for people under the stay-home safe scheme, do we have any increase in the number? And for the compulsory testing arrangements, does THPN have any recommendation for the government? So any possible, say for for testing without stay-at-home orders? Is that how we can achieve dynamic zero infection? A question for Dr. Sarah Ho. For moving patients outside A&E departments into indoors, how many people have been moved to indoor areas? Will the priority be given to the elderly and children? How long did they have to wait outdoors before being moved indoors? And the second question regarding changes to the community isolation facilities. Do we have any figures? Yesterday you gave the figures that the median stay was 11 days. Do we have any update on this? Now there is talk about day treatment centers will be repurposed for receiving patients. Would you discuss with private hospitals about doing non-emergency surgeries in private hospitals? And for the private healthcare institutions, can they help receive some patients? And there has been call over the days for healthcare workers to help out. How many people have signed up to help out? As for the figures about the Stay Home Safe scheme, 9,685 people are under the scheme. That's the figure as of last night. As for the other figures, testing, etc., I don't have the information. I believe the government will announce the details in due course. As for the Shengshui slaughterhouse, we will follow up on that. And we don't have the results immediately. As for the median stay at hospitals, the number is roughly the same as yesterday, being 11 days. As for the situation after the revised discharge criteria kick in, we will see the changes being reflected over time, but not immediately. We have thousands of infection cases every day. That has been the case over the past few weeks, so we may see changes only later. As for the day facilities being repurposed for facilities receiving patients, as was the case over the previous outbreaks, we work with private hospitals. Some medical procedures, cesarean section, or some orthopedic surgeries, or some other medical checks, or some internal screening, etc. These things can be done elsewhere. And for this wave of outbreak, we have been in touch with private hospitals. We have been in discussion about areas where we can cooperate and items and things we can cooperate on. Private hospitals and private healthcare practitioners have indicated willingness to work with us. So far, more than 10 are willing to help. So we would like to appeal to more private healthcare workers sign up and help us out through our office. Speakers not using a microphone. We're in discussion about that. Next, the journalist at the back in the middle. Now TV. Question for Dr. Chuang. You gave us some figures about people who have passed away and the vaccination status of these people. Do they cover the 15 people who passed away announced by the hospital authority just then? Just then, you said that some people at the public hospitals are still waiting for triage. How long is the wait? Last night was cold. Did they have to wait outdoors overnight? We received a report about Cheng Kwan O. There's a construction site at Lam Tin Tunnel. There were hundreds of workers infected, but the work is still going on at the construction site. Any follow-up for this construction site? And for people under the Stay Home Safe scheme, so people who test negative on day 14 can go out. But if someone in the same household and it has been less than 14 days since the positive result, can the person who tests positive on day 14 still go out? Just then, we're talking about the first 46 cases, so they do not cover the death figures just announced by the hospital authority. We don't have the figures on that yet. As for the Cheng Kwan O Lam Tin Tunnel, a few days ago, we started seeing cases. We're in touch with them and get them to conduct disinfection. And for those infected, they have been asked not to come to work. So there has been some transmission, and that will require further follow-up. Just then, you mentioned, I didn't get your question. You're saying that some infected patients went home. Speakers not using a microphone. For this patient who tests negative on 14 after a rapid antigen test, this person is free to leave home, but a family member who's infected will have to wait for the test result on day 14. Just then, you mentioned the waiting time at the A&E department. For those waiting for hospital admission, we will do our best to find a spot for them to wait indoors. And for those waiting for testing, this figure is constantly changing, and it depends on many things. Depends on the number of patients waiting for the testing and the kind of procedure the patient's waiting for. We will keep in view the situation. If possible, we will want to have the patient wait indoors. Next question, we'll take an English question.
This is from the South China Morning Post. May you please first clarify among the cases today, how many are in serious conditions and how many are in critical infections at the moment? And also about the HA staff, how many have been tested positive in total since the fifth wave? And what's the proportion of staff members infected compared to the entire HA workforce? And would the help of private sector be able to alleviate the problems at the moment? Will you be asking the private sector to come in to help? And another question is, a lot of things have been done to move people indoors during the waiting times, and there's also a taxi fleet now dedicated to the infected patients, and also a WhatsApp helpline. How have these measures eased the situation at the moment? And because right now there's still long queues, and how long are people waiting when they are at the hospital?
We have over 10 patients are in critical conditions. Their age range are from 45 to 93. And for the serious, we also have several dozens of patients are in serious condition. For the HA staff, I think the cumulative, we have already a few hundreds of staff have been tested COVID positive. Concerning the private medical or nursing staff, and we have enhanced the locum office application procedures by creating a WhatsApp number. They can simply upload their annual practicing cert, and then we have designated staff to contact them. Hope with the facilitation or process, more and more applicants can come to join our team.
The next question, the journalist at the back. Cable news. The first question for the hospital authority. We visited Kwong Wah Hospital. Some elderly were still waiting outdoors. Did they just arrive today? Or does it still take some more time before you can move them indoors? Yesterday, the chief executive said that a few days ago, a community hall was secured outside near Kwong Wah Hospital to accommodate the people, but someone was saying that they will have to look at the situation of the patient. Can you tell us what's the decision-making process like? Why is it that they have to look at the situation of the patient before moving the patients to the community hall? Follow-up question about Kai Tak and the construction site in the area. We know there are infection cases at the construction site. 30 or 40 people were infected at these construction sites. Does the CHP know the number of infected workers at these construction sites? The construction companies asked the workers to not come to work until testing negative, but there has been a lack in the test results. So some workers have to go to work before getting a negative test result. Don't you think that's bad? We have had construction sites that had to suspend work because workers got infected. But now there is no requirement for the workers to suspend work. So what's the criteria? Some of our readers or viewers also told us that they got an indeterminate test result. But the second time around, the test came back negative. But the Department of Health asked this person to be isolated. So can you tell us what's your criteria? Does it mean that a single indeterminate result will require hospitalization? And about a 14-day quarantine, home quarantine, when does the clock start? Does it mean the test, does it start with a positive test result, or does it start with a notification from the DH? We are aware of infection cases at construction sites. It may have its origin in community infections, and then due to some contact in the construction sites, the workers get infected. So we have asked the construction sites to conduct thorough cleansing. They close the site for now and conduct cleansing, but there is no hard and fast rule for them to suspend work for 14 days. We normally require a thorough cleansing and the workers to get tested. But once testing starts, many cases may be uncovered. For indeterminate test results, this person may test positive or negative, so a subsequent negative test result will be no reliable basis to tell whether this person is infected or not. So for indeterminate cases, we treat them as preliminary positive cases and arrange hospitalization. But for now, the wait may be very long for preliminary positive cases. To play safe, this person should be treated as an infected person and wait for 14 days. But if this person subsequently tests negative at the hospital, so maybe this person has never been infected.
Sorry, speaker is not using a microphone. Sorry, the speaker is not using a microphone. Well, we have to look at individual cases. In theory, if there's never been a positive test result, then maybe that may never become a confirmed case. You say how we count the 14 days for home isolation, right? Now it should start counting from the day of receiving a positive test result. That's how we start counting the 14 days. For patients waiting outside the accident and emergency department for hospitalization, now we have arranged for all of them to wait indoor in general, but then there are some waiting for triaging and testing. The medical procedure may be complex, some may be waiting for blood samples to be collected, and some may need x-ray, but then it's so cold in these few days, and so we've learned from our experience, and we will try to arrange for patients to wait indoor as far as possible. So we hope patients also appreciate that there are many people going to the A&D department in the past few days. Sorry, the speaker is not using a microphone. The speaker is not using a microphone. I do not have the information at hand. Now, for indoor spaces that we could use, we will make use of them. It's colder today than yesterday, of course. It would be really tough to make patients wait outdoor. Next, please. Dr. Chuang and Dr. Ho, I'm from TVB. First, some questions for the hospital authority. You mentioned that you would arrange for patients to wait indoor as far as possible. But then we see in many hotels, there's still triaging being done outdoor. Now, you have stopped the day services, so how come you still could not arrange for all patients to wait indoor for triaging? Is there still something you couldn't get done? And on public-private sector collaboration. Now, some private hospitals says that they have the capacity to take on patients who are not infected. So what would be the ideal number of patients to be transferred to private hospitals so that the pressure on public hospitals could be relieved? Now, private patients could also help to take on some infected patients. So what are the considerations on the part of private hospitals? What do you know about the progress of discussion with them? Now, a question for the CHP. The 15 death cases announced today, do you have information about these cases? Oh, sorry, this is also a question for the hospital authority, actually. Now, a question for Dr. Chuang. Yesterday, the chief executive said that it may take 2 to 3 months before the epidemic stabilizes. We are seeing several thousands of cases, new cases every day. So do you think it's the case? It will stabilize in a few months? And now, if we include the testing capacity provided by central authorities and and so on, does it mean that you could keep up with the testing demand? Could we see a daily number of over 10,000? And finally, if we go for universal testing in future, and if there are many infected cases, do you think there are sufficient isolation facilities to cope with the amounts? At A&E department, there are some new patients and patients waiting for admission. And we'll try to arrange for these patients to wait indoors as far as possible. As for patients who are there to take tests, we will arrange for them to stay indoor. But of course, some patients may choose to go outside where there is better ventilation. But as far as possible, we will arrange for them to wait indoor. For the public-private sector collaboration scheme, we know that there are some patients, say, who need orthopedic surgeries. There is a collaboration plan, a scheme with private hospitals. Now, with this wave of epidemic, we are still in discussion about the feasibility of including other surgeries under the public-private partnership scheme or collaboration scheme. You ask about the number of confirmed patients. Sorry, speaker is not using a microphone. The speaker is not using a microphone. Well, we'll try to help as far as possible with. And even if we could help a case, is fine. Now, for example, if someone needs an emergency orthopedic surgery, if the private sector could help with that, it would be useful, given the severe epidemic. Now, I think it's hard for us to predict a trend, but then it's still an upward trend. There are no signs of a downward trend yet. Perhaps we probably have to wait for some time for the trend to come down. For preliminary positive cases, for most of the preliminary positive cases could be confirmed the following day. But then for some cases, we couldn't confirm them. And we believe it's because the private laboratories have not yet sent the samples to our laboratory. And of course, in some cases, for various reasons, we still could not confirm a case, even though we've received a sample. Maybe there's a problem with the testing, we have to redo the test, or perhaps we still could not test a sample after 24 hours or so on. But anyway, there aren't many such cases. Now, today, we have over 6,000 confirmed cases, and then we have 7,400 preliminary positive cases. And that includes all the preliminary positive cases we have so far. Of course, for most of the cases, we received information yesterday, but then there are a small number of cases received earlier for reasons I just explained. As for testing, I don't have further information on that. The lady over there, please. Yeah, I'm from Ming Pao. First, a question for Dr. Ho. It's mentioned that some patients may choose to wait outside the A&E department while they're waiting for testing. So is there enough space outside, or rather is there enough space indoor for these people to go back to inside if they wish? Now, we know at the Characters Medical Center there are still many people waiting. It's so cold today. If people can't go indoor if they choose to, would that actually make the condition worse? And then yesterday we're told that you're in discussion with the government to see whether there are other indoor venues for the waiting purpose. Is there any progress? Did you manage to identify any indoor venues for this purpose? And the number of critical cases, and what is the occupancy rate of the ICU? And then for the 15 death cases announced today, do you have their age profile and vaccination records? how many people met the latest discharge criteria? Do you have the figure? Now a question for Dr. Chuang. For people who have stayed home for 14 days with a negative antigen test result, do they need to inform CHP so that they could end their home isolation? Will they get any certification? Because if people use the PCR test, they have to wait a long time for the test result. And if we only start counting the 14 days after receiving a PCR test result, would there be a delay? Could we start counting from positive antigen test result?
To determine whether a case is a positive or preliminary case, we will look at the PCR test result. For the 14-day quarantine, or the wait to be admitted to an isolation facility, that's how the 14 days start. But for someone who requires no hospital admission, or for someone who has been discharged from community isolation facilities, a rapid antigen test will do. The scientific evidence shows that for those who test 10 to 14 days after testing positive, this person is no longer infectious. So this person can leave the isolation facility after 14 days. That won't be necessary. As long as a rapid antigen test is done, and that's fine, then they will no longer have to notify us. Just then I mentioned some patients at the A&E department. We'll try to get them to wait indoors. Right now we have a surge in the number of patients. Different parts of the hospitals have been converted into waiting areas for patients, break rooms, for example. But these places weren't designed for patients to wait there. So now we put in air purifiers and other equipment there. So for the relatively younger patients, they may find it pretty stuffy indoors, so they can choose to wait outdoors. But I do see it's very cold today, so not many people will choose to wait outdoors. So this is just to clarify the matters. And for community halls, the government is identifying different sites to turn them into isolation facilities. We're waiting for further announcements from the government. And for the ICUs, the occupancy rate is 60 to 70%. For the death cases, 15 patients passed away. The age are between 50 to 99. 10 are male, 5 are female. For discharge criteria, we are arranging all those discharge and transfer procedures, so we don't have the figures just yet. So the patients will be sent to a place that suits his or her condition. The speaker's not using a microphone. And most of them are unvaccinated. Maybe just 2 of them were vaccinated. I don't have the breakdown. That concludes the press briefing today. Thank you.